Hello everybody! In this video we are going to highlight some important points around contraception in the context of HIV. In terms of STI prevention, the promotion of dual method use must be prioritized. We know that condoms provide the best protection against STIs and HIV, second only to abstinence and mutual faithfulness with an uninfected partner. Remember that an STI can increase an HIV-negative person's risk of becoming infected with HIV and an HIV-positive person's risk of transmitting HIV. It is also important to emphasize that there's a higher pregnancy rate if condoms alone are used. Male and female condoms should always be offered in combination with all other contraceptives. Remember that female condoms may be an acceptable option for women whose partners refuse to use male condoms, or for couples who are not able to use male condoms due to latex allergies. It is important to ensure that people know how to use condoms. Thereafter, always encourage correct and consistent condom use, but also acknowledge that method failure, such as breakage or slippage, and occasions where condoms are not used occur. It is essential to provide information about post-exposure prophylaxis. It is also important to remember that condom use is aspirational for everyone. Not everyone has the ability to negotiate condom use, but we still aim to inform everyone. There has been mixed evidence for over 2 decades as to whether using hormonal contraceptive methods increases a woman's risk of acquiring HIV. This is particularly important for areas where high rates of HIV coincide with high usage of DMPA injectable contraception, such as sub-Saharan Africa. The World Health Organization has continuously monitored the available evidence and in 2016 commissioned an update of a 2014 systematic review of evidence to include new studies. As a result of these findings, the recommendations for use of progestogen-only injectables among women at high risk of HIV have changed from Category 1 to Category 2. The new guideline for women in this category is that they can use progestogen-only injectables, but need to be advised about the concerns regarding the increased risk of HIV acquisition, as well as about the uncertainty over whether there is a causal relationship, and about how to minimize their risk of acquiring HIV. Efavirenz potentially interferes with the efficacy and action of the subdermal progestogen-only implant. The National Department of Health currently advises against the use of the implant in women on FDC. According to the WHO and CDC, the implant is still Category 2 in patients on ART containing efavirenz. Studies have shown, although there are higher pregnancy rates in women using the implant with efavirenz than in women not using ART, the absolute pregnancy rates are still lower than for other hormonal contraceptives. It is important to note that no studies have assessed the effectiveness of implants during the later years when progestin levels are lower and the risk of failure from drug interactions might be higher. Patients must be counseled on the reduced effectiveness and dual method use should be advised. As a general comment, remember to always review the WHO medical eligibility criteria when assisting a patient in selecting a contraceptive method, especially in the context of HIV, as certain medications used in the treatment of HIV or its consequences may influence the classification category of certain methods. Patient factors are important. Furthermore, the regimens used for HIV are constantly changing, and so we need to be sure to check what the current best evidence is.